Hello, everyone, and welcome to NUR 410 Nursing Research, Reading, Using, and Creating Evidence. I am your professor, Dr. Marion Johnson, and we're at week 3. Excellent job, everybody. Excellent job. I'm very impressed. Please don't forget to work on your projects on a week-to-week basis so that you can keep up. And if you have questions, it's one section at a time, much easier to tackle. Any questions, text me, call me, email. So this week we're going to start with selecting an appropriate research design. In the best of all possible worlds, evidence would be the result of well-controlled, perfectly designed studies. Of course, most nurses do not practice in the best of all possible worlds. Nursing research is planned by making a series of decisions, each of which involves weighing alternatives and options in the search of knowledge. So it's important then to understand each of the predominant research designs so a study can be planned that the best answers the research question and is therefore the strongest evidence for practice. To call this process design may give the wrong impression. This singular word implies that it is an event that happens and then is complete. In reality, design may be a circuitous process. So with each design producing a variety of implications that require consideration and that may even require the researchers to revisit earlier decisions. So the ultimate result of this process is a detailed plan for ensuing research project which addresses the research question with a minimum of bias. Bias may come from several resources in a research study: the researcher, the subjects, the measurements, the sampling procedures, and solid design is the best way to control the threat that bias presents to the overall credibility of the results. No design is perfect. The researcher can predict some threats that will require attention during the design. Others may arrive unanticipated in the midst of the study. The design process entails a series of decisions, balancing research rigor with reality. If a researcher considers design options thoughtfully, makes decisions based on the goals of the study, and can provide a rationale for each decision, the final product will be valid. So, what is design? A research design is an outline of the study in both a macro sense and micro sense. From a macro perspective, design refers to an overall approach to the study, grounded in a set of beliefs about knowledge and the question must be answered. When this macro view is adopted, only a handful of research classifications are apparent. Each has a specific characteristics that bring with them unique strengths and weaknesses in producing credible knowledge. These macro research approaches have specific kinds of questions that they best serve. And part of the researcher's job is to match the requirements of the question to the uniqueness of a study type. Research design. The overall approach to or outline of the study that details all the major components of the research. Macro decisions are among the first to be made, but each large classification of studies encompasses numerous ways to conduct the study. Dealing with these choices requires a micro view of the research process, requiring decisions that will give the researcher specific guidance in implementing the study. This micro view is called research design. For quantitative studies, the design details how the subjects will be selected and assigned to groups. the way the intervention will be applied, a measurement strategy, and a plan for data analysis. The goal of the design in a quantitative study is to minimize error, limit the potential for bias, and address clinical questions as well as statistical issues. In qualitative studies, the design describes the planned approach to data gathering, including the researcher's belief about the nature of the information to be generated, criteria for selecting informants, general guides for data collection, and plans for data analysis may be explicit in a qualitative research design. Both the macro and micro views of research design are focused on one outcome: answering the research question with the greatest level of credibility. Reflecting on this overriding purpose can guide the researcher in decisions that must be made. The basis for design selection. So for everybody watching, I am drinking lemon ginger tea tonight out of my Follow My Own Arrow mug, bought by my son. So the basis for design selection, and I may give a point since you guys are collecting points right now. So ultimately, the basis for selecting a design is the demands of the research question. If a research question has been carefully considered and purposely constructed, then it can be matched to a specific design. This match between well-constructed question and best possible answer is the goal of the research design, of the research process. The nature of the variables of the study may keep the ethical researcher from manipulating the environment or the treatment situation. These ethical limitations are strong ones and may require a weaker design in exchange for subject protections. For example, it would be unethical to inflict a disease on a patient intentionally to test a treatment for it. Other factors affecting design are the sampling plan and the measurements, which often present a challenge. A population may be inaccessible, or an instrument may possess low reliability. The researcher brings his or her own strengths and limitations to the study. A specific researcher may not possess the skill and competence to conduct a wide range of study types. Researchers often focus on one tradition or even one design, and for most of these studies they conduct. Even when the researcher has the skill and competence to conduct the type of research needed, he or she may not have the resources to carry out a study in an ideal way. These resources range from measurement instruments to data collection forms to software, all of which are often expensive and difficult to obtain. Almost all research studies require funding for expenses. All of them require time. Both may be in short supply of the nurse researcher. Without the necessary resources, even a strong design may wind up with compromises during execution. Consideration of the available resources, people, money, materials, should also be part of the research planning process. The time frame is another important consideration in research design. The length of time available to the researcher from planning to implementation to write-up is a critical concern when finalizing design decisions. It would be unrealistic to plan a longitudinal study of the development of patterns of inference as they mature into toddlers, for example, if the researcher has only 1 year for the study. The amounts of control the researcher needs in the study provides guidance in the design of the study. Studies that require a high level of control, for example, drug trials and intervention studies, will need a high level of structure. Threats to the validity of the results may be anticipated and dealt with a priori or before the study begins. Quantitative studies are often concerned with managing threats to internal validity. In some studies, qualitative or descriptive ones, control is not much of an issue. The qualitative paradigm is a naturalistic one, requiring only that the researcher have general direction prior to starting the study. The research design may be planned, but is allowed to evolve as the study progresses. Emergent designs are expected in qualitative research. Qualitative researchers are less concerned with the effects of Qualitative researchers are less concerned with the effects of extraneous variables because they are not measuring effects at all, but rather attempting to understand the phenomena. This understanding requires that using the subject's frame of reference, not the researcher's perspective, as the guiding voice in the study. For these studies, very little may be prescribed as priori. Finally, the researcher must consider the ultimate audience for the study results. Some clinical fields focus on specific designs. For example, the practice of pharmacy is based most exclusively on evidence produced via randomized controlled trials. The profession of nursing uses a variety of research paradigms to answer questions about nursing care, yet even with the profession, some audiences expect specific types of research. For example, critical care nursing, with its focus on data-driven decision-making and managing physiological responses, relies heavily on the scientific method to produce evidence. Mental health nursing, in contrast, often seeks guidance from the results of qualitative studies. The expectations of the audience that will be reached with the study should be incorporated into the design decisions. It is not always possible to control a research process as well as one might desire. A host of practical issues may affect design. The subjects are human beings, after all, and they may behave in unpredictable ways. They may be difficult to recruit or to keep in the study. The researcher may have limited access to the subject's information or may have to rely on secondary data. Subjects may be untruthful, behave unnaturally, or refuse treatment. It is important to emphasize that all studies have strengths and weaknesses. No single study can be definitely or perfectly designed. In turn, it is the convergence of findings across studies that adds knowledge to professional practice, not the perfection of a single design. That's from Wallace and Clark of 2012. Although the researcher should strive to control extraneous variables and threats to validity as much as possible, every study will have its limitations. If the nurse researcher waits until the perfect design is achieved, research will never get accomplished. The design decisions. Design decisions paint the study in broad strokes first, and then hone in on more detailed level as the study is planned. Different decisions may have different relative weights depending on the amount of structure needed in the study. For example, sampling might be more important in a case control study where matching of cases and controls is essential. Conversely, qualitative studies requires more emphasis on the way information is elicited and checked with informants. So willingness to communicate verbally may be a primary concern. Study design always involves trade-offs. Some design flaws may have little impact, others may fatally affect the credibility of the results. The researcher's obligation is to clarify the purpose of the study and design the study to achieve this perfect purpose in a trustworthy way. In the end, there is no single best design. Even expert researchers often disagree on the merits of a particular design decision. Although some designs provide stronger levels of evidence for nursing practice. In reality, all good designs are rigorous and systematic. The nature of the data collected may vary substantially, but a focus on finding truth should be unwavering in a good research design. A great deal of the study's credibility is based not on the researcher making a single correct decision, but rather on the researcher making a sequence of defensible, rational decisions. It is probably unrealistic to think that these decisions, as occurring in a particular sequence, researchers often move back and forth between decision levels that are interrelated rather than mutually exclusive. So in general, however, the decision-making process has three major phases. Identify assumptions about the knowledge to be gained from the study. Select a design that serves the purpose of the study. And develop detailed plans for implementation of the study. These phases start with a high-level macro view of the problem and purpose of the study and focus on more detailed decisions as the design plan unfolds. Think of these phases as looking at the study with more and more powerful microscopes, focusing more tightly with each subsequent look. Identify assumptions about the knowledge to be gained from the study. When designing a research study, the researcher must reflect on any assumptions he or she has made regarding the nature of the knowledge needed to answer the question. These assumptions will guide the researcher to a quantitative or qualitative design, or may reveal that a mix of both methods is required. Quantitative designs are appropriate when the purpose of the study is to measure the effect of an intervention, test a theory about relationships, or describe a phenomenon with precision. Quantitative designs require measurements of some sort, so they will ultimately involve the analysis of numbers. Such studies require control of the internal validity for trustworthiness and strong external validity of generalizability. Quantitative designs are appropriate when the results must reveal the true relationship between a cause and effect or between two variables. Measurement gives the researcher a level of certainty about the relationship that is quantifiable. Measurement gives the researcher a level of certainty about the relationship that is quantifiable, and the effects of error and random chance can be calculated. The control inherent in a quantitative design allows the researcher to rule out rival explanations for the results and quantify the amounts of confidence the reader can place in the findings. Qualitative approaches to design are appropriate when the purpose of the study is to understand the meaning of the phenomenon. The qualitative researcher has a goal of describing social reactions and interactions with such vividness that the reader can understand the meaning of the event, even if he or she has not experienced it. Qualitative research can also be used to develop theories, build models of relationships and interrelationships, and develop instrumentation. Qualitative research places little emphasis on control. The content for the study is a natural one, and the study is allowed to unfold as information is gathered and analyzed. Often, a qualitative study follows a path marked by twists and turns as the investigator strives to understand the phenomenon by exploring its meaning with informants. The design is an emergent one, with only general guidelines planned up front. This emergent design enables the qualitative researcher to follow leads provided by informants to understand the social context for behavior. A mixed method is appropriate when a combination of meaning and control is needed. Frequently, a mixed method is adopted when a qualitative approach is used to design an instrument or an intervention that is substantially tested for effectiveness using quantitative methods. A mixed method may also be indicated for evaluation research, whereas effectiveness, efficiency, and satisfaction are important elements. The desirability of a treatment may be measured using qualitative measures, while the effectiveness of the treatment is documented quantitatively. Mixed methods seem attractive. It makes intuitive sense to consider the meaning of an event prior to testing its effectiveness, but they are complex, difficult designs to implement. The rigorous nature of both research traditions must be reflected in the design, and the researcher must be competent in both traditions. Although these traditions may be diametrically opposed, in actuality, they have much in common. By nature, the characteristics of one may overlap from those of another. Both quantitative and qualitative approaches are characterized by rigorous attention to the scholarly nature of the work. Both aim for reliability of results, confidence in the conclusions, and a focus on creating credible evidence. Both research traditions have a single goal: to establish truth. Although specific methods may be quite different, the goals for each are to produce quality results that answer the question in a trustworthy way. In that way, they are much more alike. Select a design that serves the purpose of the study. Once assumptions of the study question have been determined, then the researcher selects an appropriate approach that will answer the research question and meet the goals of the study. This selection process is the result of a series of decisions based on reflection on the aim of the study, the concepts under the study, and the nature of the research question. The researcher can make these decisions by answering a series of questions. Is the aim of the study exploratory or confirmatory? Exploratory studies are often qualitative or mixed method studies, but they may also be quantitative if measurement is employed. Exploratory studies are classified as descriptive, even if they may describe relationships and associations. They explore and describe a given phenomenon. Survey methods are frequently used for exploratory studies. Mixed methods are also popular choices for the initial exploration of a topic. For example, a study that explores reasons that nurses choose a clinical specialty may determine the specific characteristics that nurse was looking for, such as certifications required and work hours, but also examine the value-based reasons a particular selection was made. The former might be measured by a survey instrument, whereas the value-based information would be more appropriately gathered through an interview. Exploratory studies. Research to explore and describe a phenomenon of interest and generate new knowledge. Confirmatory studies are those in which a relationship between variables have been posed, and the study design is designed to test the relationship statistically while minimizing bias. In this case, some form of study to determine relationships or examine causality is required. Confirmatory studies are more structured and controlled than exploratory studies. These studies require careful definition of the variables and concepts of interest so they can be adequately measured and analyzed. Confirmatory studies are often next steps from exploratory studies. For example, an analysis of the results of a knowledge-based questionnaire for diabetic patients might be used to design a specific diabetic education program that is substantially tested for effectiveness. Confirmatory studies, research in which a relationship between variables have been posed and the study designed to examine this hypothesis. Which concepts will be studied? A clear definition of the concepts that will be studied guides the design of the study and the subsequent measurement strategy. In quantitative research, the concepts that are of interest are translated into measurable characteristics called variables. A variable is a characteristic, event, or response that represents the elements of the research question in a detectable way. Variables are carefully described up front to guide the design of quantitative studies. Several types of variables may be used to represent the intent of the research question. Variable. Characteristic, event, or response that represents the elements of the research question in a detectable or measurable way. Descriptive variables. As the name implies, descriptive variables describe the sample or some characteristics of the phenomenon under study. A descriptive variable may represent demographic data about the subjects, for example, age, gender, ethnicity, or measurable characteristics, for example, blood pressure, weight, or hematocrit. The variables of interest may be perceptual, as in responses on a pain scale, or attitudinal, as in patient satisfaction. The primary characteristics of a descriptive variable is that it is used solely to provide a composite picture of the subjects of study. Descriptive variables are not considered part of a cause and effect equation, and although the researcher may look for associations between variables, no attempt is made to manipulate or control descriptive variables. Descriptive variables. Characteristics that describe the sample and provide a composite picture of the subjects of the study that are not manipulated or controlled by the researcher. Research variables. Research variables are introduced into a study explicitly to measure an expected effect. A research variable may be categorized as either independent or dependent. An independent variable is one that applied to the experimental situation to measure its effects. Such a variable is independent of the naturally occurring situation and is introduced into the experiment so that its impact on a specific outcome can be quantified. In a true experiment, the independent variable is manipulated, meaning it is introduced by the researcher. It may also be called a treatment experimental variable or intervention. One can think of an independent variable as the cause in the cause and effect. For example, if a nurse is interested in studying the effects of therapeutic touch on a post-operative pain, therapeutic touch is the independent variable, that is, it is artificially inserted into a situation to measure its effects. Independent variable, a factor that is artificially introduced into a study explicitly to measure an expected effect, the cause of cause and effect. Some designs consider causal variables to be independent even if they are not manipulated. In these causes, the variable of interest is found in its naturally occurring state, and subjects with these specified characteristics are compared to those without it to understand its potential effects. For example, a researcher might be interested in studying the effects of breast cancer on body image. Although breast cancer is not manipulated, its effects are of interest in the study, and it may be referred to as an independent variable. Technically, independent variables are only those that are artificially introduced to subjects, but the term is used loosely to apply other types of causal variables. A dependent variable is the outcome of interest. In an experiment, it is expected that an independent variable will have an effect on the dependent variable. In other words, the outcome is dependent on the independent variable having been introduced into the experiment. Thus, the dependent variable can be considered effect in the cause and effect. In specific types of design that is focused on prediction, the independent variable is more accurately called a predictor variable, and the dependent variable is referred to as an outcome variable. Although the terms independent and dependent are commonly used to describe the predictive relationship, technically the terms are not accurate descriptions of these variables because the predictor variable is not manipulated. Predictive studies are classified as descriptive, so these variables are more accurately referred to by their function rather than by their dependent nature. For example, a nurse researcher may want to identify the characteristics of patients who present to the emergency room who are at high risk for multiple visits. In this case, demographic variables such as age, diagnoses, socioeconomic status, and family support might be studied to determine whether they are predictive or repeat admissions. In this example, age, diagnoses, socioeconomic status, family support would accurately be described as predictor variables, and repeat admissions identified as the outcome variable. Extraneous variables. One goal in study design is to control external influences on a process that rival explanations for the outcome can be rolled out. These rival explanations are considered extraneous variables, meaning that they exert an effect on the outcome but are not part of the planned experiment. Realistically, extraneous variables exist in every study, but they are most problematic in experiments. Extraneous variables can be controlled if they are expected or recognized when they occur. The most problematic extraneous variables are those that cannot be predicted, are difficult to control, or go unrecognized until the study is complete. Extraneous variables confuse the interpretation of the results and may render experiments so flawed that the results cannot be used in practice. A primary goal of research design, particularly experimental designs, is the elimination of control of extraneous variables. Extraneous variables, factors that exert an effect on the outcome, but that are not part of the explained experiment and may confuse the interpretation of the results. A specific type of extraneous variable is a confounder. Confounding occurs when the association between cause and effect is partially or entirely due to a third factor that is not of the experiment. For example, a study might show that alcoholism is a causative factor in lung cancer, when in reality the relationship is due to a confounder. Smoking, because smoking rates are higher among alcoholics, this third factor confounds the true relationship between alcoholism and lung disease. For a variable to be a true confounder, it must be associated with the independent variable and a true cause of the dependent variable. When a confounder is suspected, the research design must be altered to control or account for its effects. The most common ways to control confounders are through random sampling, matching subjects, and statistical analysis of covariates. Qualitative concepts. The term variable is rarely used in qualitative research. This is because a variable, by definition, is something that is measurable, and measurement is not typically part of qualitative design. However, qualitative studies do have goals related to understanding a phenomenon, belief, perception, or set of values. In the case of qualitative research, the design is driven by the nature of the information to be gained from the study, and establishing this relationship requires thoughtful consideration of the particular phenomenon of interest. Although it is unnecessary to develop operational definitions for qualitative phenomena, the researcher should be able to articulate the concepts, theories, or processes that are of interest. In the case of grounded theory, a specific type of qualitative research design, the researcher may also plan to study relationships between the phenomena. Whether the researcher plans to measure variables or study phenomena, consideration of these characteristics will help determine the specifics of the research design. Sometimes it is necessary to incorporate elements of both types of study. Identifying the variables and concepts in a study is an important precursor to design. By clarifying the conceptual focus of the study, the researcher can begin to implement the research question in a way that lends itself to study. What is the nature of the research question? Once the conceptual basis of the study has been articulated, the research question becomes the focus of more specific design decisions. The nature of the research question serves as the foundation for the next set of decisions, namely classification of the specific research study design. Most research questions can be classified into one of four categories: questions that seek to describe a phenomenon or population, questions that seek to quantify the nature of relationships between variables or between subjects, questions that seek to investigate causality or the effects of interventions or risk factors, questions that determine effectiveness of interventions as evidence for practice. Descriptive research. Descriptive research is appropriate when very little is known about the question at hand. Often researchers seek to fix problems without understanding the current problem as it exists. Descriptive research can help the investigator discover a baseline performance level, describe a subject's response to treatment, or determine the desirability of a new service. Research questions that begin with What and why generally indicate a descriptive study. Descriptive studies set out to describe in detail some process, event, or outcome. They document the characteristics of a subject of some sort. Subject appears in quotes here because it represents a broad range of responsibilities other than individuals. For example, a subject may be a child, a patient care unit, an emergency department, a county's health, or a unit's diverse event rate. Once a subject of interest has been described, an exploratory study sets out to discover as much of the subject as possible and to find themes that can help the researcher effectively derive meaning from the study. Descriptive studies. Research designs to describe in detail some process, event, or outcome. Such a design is used when very little is known about the research question. Descriptive qualitative studies rarely have detailed procedures identified up front. Instead, the design of a qualitative study is emergent, in that the details of the study become apparent as information is gathered and the nature of the information is evaluated. The qualitative researcher will identify a specific approach to the data gathering and a philosophical basis for the approach, but rarely creates a detailed plan prior to initiating a qualitative study. In contrast, most quantitative descriptive studies feature a clear plan for implementation that outlines the sample, the measurement procedures, and statistical process that will be used to summarize the data. Descriptive studies are often exploratory. But they can also be confirmatory, meaning the researcher suspects that a phenomenon or event exists in a population, and he or she sets out to confirm those suspicions. Most often, however, descriptive studies are applied when very little is known about the situation, and baseline knowledge is required to be able to design effective nursing practices. Table 6.2 highlights the commonly used descriptive designs and characteristics of each detail. Details of the various designs are described in depth later in this text. Research that examines relationships. The research question often reflects a need to go beyond describing single characteristics to determine whether a relationship exists between variables or between subjects. This type of research can fall into two categories: correlation research or predictive research. Correlation research involves the quantification of the strength and direction of the relationship between two variables in a single subject, or the relationship between a single variable and two samples. So, for example, a researcher might want to determine if there is an association between anxiety and blood pressure in the preoperative patient, or the researcher may seek to study the nature of anxiety between mothers and daughters. Correlation research designed to quantify the strength and the direction of the relationships of two variables in a single subject, or the relationship between a single variable and two samples. The purpose of the predictive research is to search for variables measured at one point in time that may predict an outcome that is measured at a different point in time. For example, given a patient's total cholesterol, could the occurrence of myocardial infarction be predicted? Predictive research designed to search for variables measured at one point in time that may forecast an outcome that is measured at a different point in time. Both correlation and predictive research are considered descriptive because the variables are not manipulated and the relationships are not controlled. Correlation and predictive research may also be legitimately to search for suggested causal relationships that may be subsequently that may subsequently be studied through experimental designs. Experimental designs are discussed in more detail later in this chapter. Table 6.3 summarizes common designs that are used to describe relationships and their associated characteristics. Research that compares effectiveness. New research designs have emerged specifically in response to the need for evidence practice. These studies seek to compare the effectiveness of a set of interventions with the effectiveness or alternative of or traditional practices. Comparative effectiveness studies focus on contrasting interventions for efficiency, cost, and usefulness to specific populations. Such studies may have many of the characteristics and randomized controlled trials but are adapted to allow for a more naturalistic approach, a faster timeline, and easier translation into practice. Comparative effectiveness research emerged in response to the necessity of answering real-world questions in settings in which range of possible options are available, and the best choice may vary across patients, settings, and time. Comparative effectiveness research encompasses both the generation of evidence and its synthesis. Evidence is generated using both experimental and observational methods. Synthesis of the evidence uses systematic reviews, decision modeling, and cost-effectiveness analysis to draw conclusions. While randomized trials are increasingly seen as artificial and difficult to implement, they will be likely to form the cornerstone of any comparative effectiveness research. In addition, modifications of the randomized trial, such as pragmatic trials and adaptive trials, may render these studies more naturalistic and practical. Comparative effectiveness research also relies on observational studies, in which the population of interest is assigned to alternative interventions based on patient, provider, and system factors and observed for the natural occurrence of an outcome of interest. Collectively, these adaptations are emerging in response to widespread demand for evidence that will immediately useful yet rigorous. New designs are expected to become more acceptable and relevant for evidence-based practice as the field evolves. Table 6.5 depicts some of the research designs used in comparative effectiveness research. Develop detailed plans for implementation of study. Many of these decisions that guide the research will be dictated by the type of design chosen. For example, an experimental design requires a random sample or random assignment of subjects to groups, whereas a qualitative study will engage in purposeful sampling. Even after an explicit design is chosen, however, many decisions remain to be made. For example, the procedures to be used for recruiting subjects, applying interventions, and measuring outcomes, to name a few. Other decisions are required to ensure that an adequate sample can be assessed and the ethical considerations are addressed. A research plan, guide, and implementation of the study describes the following design elements: a sampling strategy, the measurement strategy, the data collection plan, and the data analysis plan. Several steps can guide the nurse when he or she is evaluating the study design. The methods section should be complete. It should be present and accurate and thorough account of every important step in the design and the conduct of the research. A strong methods section supports replication, one of the hallmarks of sound research that contributes to an overall professional body of knowledge. In practical terms, the nurse should be able to get enough information from the description of the methods to conduct the study exactly as the author did, using different subjects to determine whether results can be generalized to another population. A thorough methods section allows comparison of findings across studies. This is critical for the systematic review process. A key way that studies are transformed into evidence-based practice. A thorough account of the subject's intervention, measurement, and analysis allows for a comparison across studies to draw a conclusion about the size of the treatment effect and the consistency with which outcomes are achieved. This section of the research study serves as the basis for the conclusions drawn about the validity and trustworthiness of the findings. A critical appraisal of study methods should lead the nurse to the conclusion that inconsistency in procedures is not an explanation for the results. Where to look for information about methods and procedures. The design of the study is usually described in the abstract of the study and again in the introduction. It should be identified in a straightforward way and clearly described. If not, it should be described early in the section labeled Methods. The design section may be called Research Design or Plan. Other words may appear in the heading such as Methods and Procedures or Methods and Materials. The description of the design should be easily identifiable and a major part of the research study write-up. The description may be concise, but it should have enough detail that an informed reader could replicate the study. If the intervention or measurement is complex, the write-up may include a separate section for procedures, which may be labeled as such as or called protocols. This section may be described as specific steps for applying the treatment and the specific steps for measuring its effects or both. Using research and evidence-based practice. All types of research designs are helpful in the application to practice. The hierarchy of evidence puts more weight on the results of experimental designs, but all types of knowledge can contribute to the effective practice of nursing. The task of the nurse is to choose the type of knowledge and therefore the range of designs that produces the kind of information needed to solve a clinical problem. Descriptive research is useful when determining the characteristics of specific populations, identifying the practices that are used at other organizations, or measuring baseline performance. This type of research is helpful when little is known about the existing state of the phenomenon or when exploring perceptions, attitudes, or beliefs. Creating evidence for practice. Creating an effective research plan involves a systematic process of considering the purpose of the study and the nature of the question, and then making decisions about the way the study will be carried out to draw the correct conclusions. These research designs are rarely clear-cut. Almost always the investigator is charged with weighing the relative strengths and weaknesses on various design elements to arrive at the best possible decision given the specific characteristics of the study at hand. That said, the researcher is well served by spending the time to consider and create a careful research plan because it will serve as a blueprint for the study as well as its documentation. The researcher needs to determine the answers to the following questions. What is the nature of the knowledge that will be required to address this research problem? Quantitative studies are needed to test interventions. Qualitative studies are needed to discover the meaning of phenomena. Which concepts are involved in answering this question? Describing the variables that will be studied or the phenomena of interest guides the measurement strategy. What is the nature of the research question? A descriptive design is required for research questions that ask about what is or that are exploratory. The question focuses on the nature of the relationship, then correlation studies are needed. Questions related to causality or the effectiveness of interventions demand experimental designs. The specifics of the design will depend on the accessibility of the population, the skills and resources of the researcher, and the expectations of the ultimate audience for the research. Which specific procedures will be required to answer the question? Once a design is selected, the researcher must determine how the subjects or informants will be recruited and how the concepts will be measured and how the data will be analyzed. Summary of key concepts. A design is a plan that outlines the overall approach to the study while being grounded in a set of beliefs about knowledge and inextricability linked to the nature of the research question. The research design is focused on answering the research question with the greatest level of credibility. Selection of a design is based on the purpose to be achieved by the study, the availability of subjects, ethical limitations, the skills and resources of the researcher, the time frame, the amount of control required, and the expectations of the audience for research. The phases of the research process include identifying assumptions about the knowledge needed, selecting an overall approach that serves the purpose, specifying an explicit design for the study, and developing detailed plans for implementation. Assumptions about the knowledge needed to answer the research question will result in the choice of quantitative, qualitative, or mixed methods approach. The overall approach of the study is determined by considering whether a study is exploratory, generating new knowledge, or confirmatory, testing theories or hypotheses. The concepts reflected in the research question are translated into measurable variables for the quantitative study. These variables may be descriptive, independent, dependent, extraneous. The concepts of qualitative questions describe characteristics, experiences, or phenomena that are of interest to the researcher. Once these decisions have been made, the research design is translated into a specific plan of study, one that can be used to guide and replicate the study. Detailed plans for research implementation form a roadmap for the research and includes specifications of procedures for sampling, measurement, and analysis. The four major classifications of research designs are those that seek to describe a phenomenon or population, those that seek to quantify the nature of relationships, those that seek to investigate causality, and those that compare the effectiveness of interventions for the application to practice. 3 considerations must be met to establish causality. The cause must precede the effect. The probability that the cause influenced the effect must be established, and rival explanations for the effect must be ruled out. That concludes our wet lecture for week 3 NUR 410. Thank you and have a great week.